So I got a lot of my information from online groups, just reading people's experiences. My breast cancer nurse, she also put me in touch with a couple of women who'd been through the surgery, and that really helped, hearing their first-hand knowledge.
So leading up to the surgery, I had the benefit of time, so I did a lot of research into different options. Once I'd figured out the type of surgery that I wanted, I was able to talk to lots of different surgeons, which really helped, till I landed on the one that I felt really confident with. I found a few people that had been through similar experiences, so it was really helpful to talk to them.
When I decided I wanted to have the surgery, I actually discussed it with my original breast surgeon. I'm someone that needs to find out everything about it and make an informed decision and feel that I've made the decision, so I live with the consequences of it. So that was an important part of it for me. I think that one of the things that's really important was, for me, I needed to have a relationship with the surgeon that was doing it. So I wanted to know that I could be confident of their skills, but I also wanted to know that I could be confident that they would treat me as an individual, they would understand what it meant to me, and that they would be respectful of my feelings.
Above all, probably I did a lot of work with my breast cancer psychologist, and I feel like that was the most useful for me in terms of preparing myself mentally and emotionally. When I was first recommended that type of surgery, the DIEP, I was terrified, but through working with psych on it, it just gave me a lot more tools to use to reframe it more as as like a positive bookend, I guess, to the cancer journey. I guess that has been the most help.
What I found most helpful in the initial part of my journey was hearing other women's stories. People that I'd met online, people even shared their pictures, their stories of what they'd been through during the lead up to surgery and then recovery, and that really helped knowing what I was going into.
When I was first diagnosed, it was horrendous, as you could imagine. I think I went through all the stages of grief, starting at despair, and eventually I feel like I'm in a space now of more hope and gratitude for the treatment that I've been able to have. But at the time it was, time stops.
I actually found the notion of having a mastectomy very confronting. I had less problem with the notion of the breast cancer because it was diagnosed early and because West Australians' treatment's so good and I knew the statistics. But the idea of having a mastectomy I found extremely confronting, and my surgeon picked up on that, and she, right from the word go, suggested that at the time of the mastectomy that she do an implant because she could see that it was really quite challenging for me, the idea of having a mastectomy.
My biggest fear was for my little one that I was pregnant with. I was absolutely terrified for her, and so I just knew I had to do everything that all of the medical professionals told me to fight it for her and I.
For women thinking about breast reconstruction, I would say do your research, look at all of the options, even if you know you don't want to do some of them, just look at them and understand what they are, and make sure you're clear on your reasons why you don't want to do that. Speak to multiple surgeons, get lots of different points of view.
For me it was important that breast cancer didn't define me, and the whole experience didn't define me, so I wanted to keep my life as normal as possible. For me, it's been a bit of a struggle to actually accept that I have to slow down a little bit, and there's some things I can't do. It's not my personality, but I think that, that's something that you have to do.
Best piece of advice that I would have would be to talk to other women. Everyone's results are different, and I just feel that if you can get a vast range of information before you go into something, it just prepares you for what you're going into.